righty. Good morning, everybody. Sorry for the delay. We had a little bit of an elevator issue in the building. This is the November 4th, 2025 convening of the Maryland Lead Poisoning Prevention Commission at the Maryland Department of the Environment. Wendy, if you would just quickly take roll, and then we will get on to adoption of the minutes.
Okay, let me close this out. Hold on 1 second. I've got so many windows open. Let's see. Okay, I'm gonna stop this. Stop sharing. My attendance. Okay. So I'm going to call the names of those that I see commissioners on. If you can introduce yourself, and if I miss you at the end, just please introduce yourself. So I see Adam on.
Adam Skolnick, Executive Director of the Maryland Multi-Housing Association, Commission member.
Barbara Moore.
Barbara Moore, Pediatric Nurse Practitioner and Director of the Lead Poisoning Program at Mount Washington Pediatric Hospital, Commission member.
Fred Banks.
Fred Banks, Program Manager for the Lead Poisoning Prevention Program.
And we have Mangela Paul.
Good morning, Mangela Paul from Maryland State Department of Education as a nurse consultant, nurse practitioner. Thank you.
Michael Ikniowski.
Doc? Not there. Okay.
I see him on, but he might not be able to, I guess, unmute. So,
Okay.
let's see. Nicola Tran.
Hi, this is Nicola Tran, Director of the Whole Home Energy and Repair Programs at DHCD.
Susan Kleinhammer.
Good morning, everybody. Susan Kleinhammer, Lead Tech Services, Accredited Risk Assessor, Commission member.
Okay, let me see if anybody's on nobody's on the phone. Did I miss anybody?
Me.
Oh, hey, you're there in person. Allie, go ahead and introduce
I'm
yourself.
the parent advocate for the commission.
Okay. Did I miss anybody else commissioner-wise?
Ruthann.
Oh, yes. Gosh, I'm off my game today.
That's
I
okay.
apologize.
And I am joined today by Riley Rochon, who is the attorney for our cases on lead poisoned children, and also working to provide property owner and tenant education to ensure the highest impact on the law. So welcome, Riley.
Thank you. Hi, everybody.
And Riley will also be working on policy around this to make sure we support the Maryland Lead Risk Reduction in Housing Law. 2 changes to the agenda, folks. I did not hear back from the Just Communities program for Sheriff Kogan, and apologies on it's like on the agenda, we both misspelled the sheriff's name and title, but we'll fix that for the next, when we get him to do that. But I think his program on how he's handling evictions and compliance with the Maryland lead law is significant. I do want to make sure to say that I did meet with the state of Maryland Department of the Environment in the interim, and I know there is potentially pending legislation coming out of the department. So I look forward that when the department is ready to potentially move that forward. Hang on 1 second. We have a hand raised by Nadia Hutchinson.
Hi, I just wanted to make sure I was marked in the attendance. Nadia Hutchinson, Baltimore Renters United. Sorry there.
Thanks, Nadia.
Okay. And thank you for joining, everyone. So we will work to get both of these on the December 4th, and if the department is moving for legislation. I know that we at GHHI are talking with Delegate Sandy Rosenberg regarding potential legislation as well to bolster and ensure that fraudulent certificates are handled in the highest degree of seriousness and support the department in penalties around that, as well as legislation to tie Maryland Home Improvement Commission licensure to compliance with the Maryland Lead Risk Reduction and Housing Law for contractors. I think Paula is going to talk a little bit about research on that in just a second. The government shutdown is obviously not helpful for many reasons for clients that we are serving across the state. But the one good news is that for the grants that relate to the U.S. Department of Housing and Urban Development, those are still flowing during the government shutdown. So if you are in an area of the state that is drawing on either healthy housing or lead funds from HUD, they are still active and they are moving. We do have a sign up. Wendy, I provided you the link. Maybe you could put it in the chat. We did not get the email traffic I had hoped for sign up on committees. So there is a dashboard or a Google sign up or SharePoint sign up. If you would put that in the chat, and I'll ask all of the members to please assign yourself to at least one committee. If not, we are going to proactively assign and call you in the next week, and would appreciate our ability to move forward on the things that your survey placed as the highest priorities. So given all of that, I also just want to say thank you to all of the folks who worked on the Lead Poisoning Prevention Awareness Week and MDE. Thank you, Paula, Brett, and your team. The Maryland Department of Health, Theo, Cliff, and the entire team there that came across the state. And on our team, Shadia Musa and Bay Hudson and Wes and Carly and Jeanette and so many others, Beth Bingham, who worked around the state to spread the word. And a special shout out to Theo from MDH, who served as Derek the Dinosaur, wearing the full costume in front of like 5, 6, 7-year-olds. But a really great job on that. And what we are working for next year to be looking at a couple of convenings around lead, not just Lead Week, where we will have clinics for helping people do application assistance, understand advocacy, training on the laws for people, both property owners and renters and residents, to make sure that people know the fullest extent of their rights and responsibilities under the law. So I think we're hopeful to do that in the first quarter of the coming year, and then to have some major event around lead over the 4 quarters of next year. So if there is nothing else there, can we get to the approval of the minutes and then get to the presentations that we have for today, please?
Make a motion to approve the minutes from the previous meeting.
Thank you. And a second, please.
Second.
Thank you. All in favor?
Aye.
All opposed? All right, minutes are adopted, and thank you. And now, Paula, I think you have results from the research of laws that may require the Department of Labor to address the issue of lead certification for contracts.
Yes, hi. So from the
Just
research,
remind everybody who you are.
oh, I'm sorry. I'm Paula Montgomery. I'm with Maryland Department of the Environment. I do outreach and education for the program, amongst other things. But one of the things that I was tasked for with the commission is to possibly tie in permitting for rehabilitation throughout the state with ensuring compliance with having appropriate accreditations for contractors that are performing services on pre-1978 residential rental properties or those that are performing specific abatement, in addition to whatever EPA requirements that they may have. So as some of you may or may not recall, these regulations used to be specifically under the Department of Housing and Community Development. And they had specific regulations that identified how a rehab was supposed to be performed. However, and I don't know exactly when this happened, but Maryland adopted the International Building Code in the last 5 years, and that was statewide. Now, each jurisdiction, that includes counties or municipalities, can have amendments that, deal with their own specific jurisdiction. However, in the spirit, they need to follow the International Building Code. So, and I don't know if anybody's ever seen the International Building Code, but it's quite lengthy. And then, so I wanted to get into looking at the specific of, because like I said, there were regulations that we used to have specific to rehabilitation. And I think that was under the building code, something 912. I don't hold me to that. But there were specific indications in that regulation that stated that any MHIC licensed contractor shall comply with any applicable state, local, or federal law, which I thought was the gotcha moment that would require them to have to comply with the accreditation requirements under the law. However, since they adopted the Rehabilitation Code, which is known as the International Existing Building Code, or the IEBC of 2015, I have been reading through that and I'm not seeing any ties into compliance with local, federal, or state code. Now, I haven't read everything,
But
obviously.
can I jump in here and I don't know if we can hand up or not on this, but can we just not ask the Department of the Environment to request an opinion from the Attorney General's office as to whether or not the department has the power to communicate with MHIC and void the license, suspend, void, or sanction the licensure of a contractor who violates the Maryland Lead Risk Reduction in Housing Law? I think it's a pretty straightforward question to see if those powers currently exist, and if they do, to weigh in on that.
So just a suggestion that I may have is, I think maybe, and Fred, you can jump in too, maybe perhaps within consultation with our directors, and maybe if we make a referral to the AG's office, that we can sit down and kind of hash out what we, I gotta read this a little more thoroughly, but I'm not an attorney. I just play one occasionally. And then, but I agree with you. I think that probably is the easiest thing to do. Absolutely.
Yep.
The other, the broader question, I think, is that we need to see if applicable licensure and accreditation requirements are mandated, in these provisions, to ensure lead safe work practices. The other thing that's kind of strange that I just happened to read through when I was not even looking for it is each jurisdiction, like I said, can have their own amendments to this. I mean, this International Existing Building Code is pretty lenient. Like, it actually says that they can issue an annual permit and not on individual projects. So, but I don't think that they do that in Maryland because they, want to generate some money so they can oversee housing issues. Anyway, that's as much as I know. And obviously, you know, we got to look into this a lot deeper. And I agree with you that we probably at some point should have our attorneys help look into this with us.
Okay.
Does that make sense to?
Yeah, I think there's just, I think the overall goal here is to see the number of areas and ways that we can have enforcement so that if, as a parent who moves into a rental property or a potential parent, or even where we have the authority over homeowner properties, right, which is a lot different.
Yeah, owner occupied
Right,
properties.
we've got to know what those levers are that we've left in silos, right?
Yeah.
And we're trying to have them into one toolbox so that we can make sure that we are like doing that. Adam, I think you are, Adam and Nadia have their hands raised. Adam was first.
Yeah, I mean, you guys just hit the nail on the head. I mean, one concern that I have is that this is one of the few places where we can, you know, attack the issue of owner occupieds. So if we only rely, as much as I would much prefer in this situation, not pass additional legislation, but if we don't, then I don't know that the department has the ability to regulate owner occupieds in this situation.
Yeah.
So, I mean, and I think this is a clear and obvious situation where if a contractor is doing work in a pre-78 house, they should be lead trained, period. You know, whether that's rental or non-rental, and they should be dealing with that. And, you know, as that owner, I mean, the owner of that house would, you know, assume that the contractor and the government would be making sure they were at least to some extent safe in this issue. And we don't do any of that right now. So I think we've got to attack it at the legislative level and have that included.
Remind me, on the annual report done by the department, do we break out the poison children by owner occupied and non-owner occupied?
Yeah.
And what's the basic, you recall the
I think last year was about 30. When I say the last report year, 2023, is between 33-35% were owner occupied.
Okay.
So it's pretty significant number.
It is significant, and we've got to find ways on education there, and we've got to find tools. My biggest concern is that when, and Nadia, we're coming right to you. When I was at the EPA Children's Health Protection Advisory Council meeting, I specifically asked the head of the EPA lead program, were you going to uphold all the current laws? That also includes, don't forget, the federal disclosure law. And if that stops being enforced, then the question was, will states pick up that mantle as a state law? And we ought to be looking at these ways, because that's one of the few ways that we have around the owner occupied side. I would anticipate realtors will probably not love that, but they should, because they should be wanting to sell healthier housing. But something for us to put in the parking lot. Commissioner Hutchinson.
This is kind of unrelated, but just because it seems like we have a policy lawyer person in the room. I was wondering if we could talk about the most recent tenant bill of rights that came out that mentions lead, but doesn't mention lead certificates.
Well, let me just weigh in there that seems to me that we ought to give somebody an opportunity to prepare to talk about that.
Okay.
And we'll happily do that at the next meeting, because that's kind of, I think that's pretty significant. And I would suggest that what we do is at the next meeting, maybe have a panel of tenant advocate lawyers that we could hear from on this.
Okay, awesome. Thank you so much. And I can share the Bill of Rights for
Yeah.
awareness.
Okay. Statewide Bill of Rights or Baltimore City?
It is Maryland State. It was enacted for July 1st of 2025.
Okay.
But it doesn't mention lead certificates. It mentions that you can take your landlord to a lawyer if there is lead paint present, but it doesn't actually talk anything specifically around the certificates themselves.
Sounds like a potential piece of easy legislation to amend that for clarity and something we should consider doing. Susan?
Thank you, Ruth Ann. Also, if we're going to talk about legislation, I would like to have somebody prepare maybe for the next meeting to have a discussion about House Bill 1367, falsifying information and penalty. I think there's some things in there that need to be discussed as far as inspectors would be concerned.
This is a proposed bill for the legislature or last year?
Yeah, it was last year's. It went into effect October 1st of this year. And there are some concerns in there of mine representing inspectors that I'd like to have a discussion on.
Okay, that's fine. Could you articulate the concern so we know we have the right people presenting?
Yeah, well, it's about fraud, and it's about the LRCA system requiring 24-hour notice by the inspectors, not only 24 hours notice, but also the time at which the inspection is going to be done. And to me, I want to know, because I'm not a lawyer, when does it become fraud if we put a 24-hour notice in that we're going to be there at 3 o'clock and we're there at 2:30?
We have discretion.
Well, she's saying the law.
I want to know how that's going to be interpreted, because I think that there's a big concern about, well, is that fraud?
I again think this could be an AG opinion of how that should be applied. I don't know if Chris and others are on the line, but Fred, I think this is something that the department should talk about, how it, whether that's going to be determined by regulation. And how they're interpreting a 24-hour notice, right? 1 business day, but this idea of a prescribed time, there should be a time in the notice to give people appropriate notice for certain. But we do have to have some realities of traffic, et cetera, in there.
I can
sure.
just briefly say, Susan, I can tell you that just from what I've seen as far as enforcement of that regulation, it's more looked at as a pattern of either not notifying us, or misnotifications, if that makes any sense.
Sure, yeah.
So yeah, we're generally not too far in the weeds as far as hours and minutes, just to be transparent. It's more about not notifying or outright just misnotifications when there's, where you're notifying us that you're going to be there at 2:30 and then, you show up a day later or, several hours later, so.
Or you don't notify.
Or you don't notify. That's the bigger issue, so.
I gotcha. I guess I just am still concerned because that's an interpretation that could change with personnel within MDE. And I know in the real world, I mean, you try the best you can to pick the time that you're going to be there. And I don't want to take away from what the agenda is for today. I think maybe we could, put this up on the table for now and have a discussion perhaps to clarify. I would certainly appreciate that.
Absolutely.
Yeah.
If you want to, yeah, we will address 1367 in the next meeting and look at this. I'm asking Fred to look into it. But if you have further concerns on it, and if I may, Nadia, do you remember what the bill number was for the Tenants Bill of Rights? And if you could maybe put it in the chat, I'm sure we can find it. And I think it was assigned to DHCD, so I'll ask DHCD to be prepared to discuss that as well in the next meeting for sure. So Paula, getting back to your research, is there anything else we should be crosswalking here? Because it does sound, we should be looking at the crosswalk, not just for contractors, but for inspectors, right? And are there other ways to crosswalk For example, on the Tenants Bill of Rights, is there anything, any crosswalk there for property owners to be aware of? And it does sound to me that we should go back to the sponsor and get clarifying language that a major right is that there is a certificate, a registration and certificate for rental units. And I think MDE should look at that, and MDE should support that clarity on that bill.
On the tenants' rights bill.
Yeah,
So just to circle back, I think two of the things that I'm gonna try to do between now and December is maybe look at this a little bit more, come up with some talking points based on your suggestions and Adam's suggestions. And work with Fred and maybe our AGs through our director's office, so we can formulate. And I agree with you. I feel like we should be asking them what for an opinion. I think that's a really good suggestion.
Yeah.
So,
I mean, sometimes that has to come from a legislator. So if it
Yeah.
does, we will, please let us know. We'll get Delegate Rosenberg to
but
do
I'm
that.
sure Dollar has AGs too, and we've
Yeah.
done cross requests. So,
Yeah.
anyway, I don't think it's that hard.
And if I
We'll make sure
can,
that the commission, at least is able to read any type of letter, because, this is being requested, not that our AG, so anyway, we'll make sure that it comes here before it goes anywhere. So we can make sure we're asking the right question.
yeah, and when, not just for a point of order that I meant to take up earlier, and I don't think Senator Washington is on, but I am asking the department to be in touch with the Speaker of the House again about replacing what is now Senator Attar, but for the delegate position on the here. And I think there has been some interest expressed by Delegate Boyce. I think Delegate Embry, might be a good choice, but also I think if we have a Baltimore senator, we ought to be reaching out to another part of the state. But it would be good to get that resolved. And it would be quite good to get somebody who's a child advocate in the legislature there. Any other discussion around the MHIC licensure issue that we're continuing to pursue? Okay, if not, I think the other thing that has to get struck now is, Wendy, unless somebody from the Department of Housing and Community Development wants to talk about it. When I reached out, they told me since they're in the change of commissioner, they would not be able to be presenting on the vacant housing plan. I'm trying to get someone to do that or provide us information on the standards for lead. I will say it is publicly posted for applications for the Commissioner of Housing and Community Development for Baltimore City. We are hopeful that they will fill that quickly. I would also like to ask the department and to invite the new Baltimore City Health Commissioner and for the department to be proactive in that invite to come and address us at the next meeting. Monthly dashboard on lead program statistics, Catherine Taylor. I'm sorry.
We have a hand raised where,
And
Nicola,
Sam.
did you have your hand
I
raised?
just wanted to clarify, this was for Baltimore City DHCD or for state DHCD?
If you have a vacant housing plan that touches into this, we'd love to know, but it was for the Baltimore City since they just kind of went out massively with
Okay.
your support. Yes.
Okay, thanks.
Do you know who is running that plan, Nicola?
I do not. I would have to find out who the person is, and then I'll also have to figure out who's in charge of the tenant bill of rights as well. Those are both not in my division, but I can find out.
You're amazing. Thank you as always. The concern on the vacant housing that has been brought up in community meetings that I've attended is the making sure that any rehabilitation work isn't spewing lead paint to neighbors. And I don't know what coordination has been done with the Department of the Environment. And sometimes it's the stadium authority involved, believe it or not. And I think that we need to ensure that the city is putting lead safe standards into this kind of massive investment that they're making there. They did, GHHI qualified, doesn't mean we get any money, but we were qualified as a technical assistance provider. So if a grantee of that program reaches out, then we can provide them guidance, and we will be putting together sort of a toolkit for this effort. But I do think the commission should be asking of the vacant housing plan in the city that it is taking lead into consideration and other environmental hazards. So Nicola, that's the intent of why we want to have somebody come and do that. Did we have any other hands up, Wendy? Can we?
No, there's no other hands up.
Okay. Monthly dashboard on lead from the city. Is Kat on?
She is on. Do you have any?
Good morning.
Hi.
Morning.
Okay, I'll share my screen real quick.
You are amazing. We appreciate you, Kat.
Of course. Okay, can everyone see my screen?
100%.
Great. All right, so just to overview.
People get the state and the city Department of Housing and Community Development confused.
Right, this is Baltimore City.
I know. It just even the slides look alike. Anyhow, go ahead.
Yeah. So just an overview of what our award and grant is. Our grant started this year in April and is set to end in 4 years. We were awarded $5,850,000. Of that money, we have $5.2 million going towards lead remediation work and $650,000 going towards healthy homes funding. So that is including items in the home that we deem as safety issues or any other items that a client may bring up to us. So our goal for this grant is to get 225 units completed for abating or doing inner control for 225 units. In Baltimore City, we also have a goal of 120 units to do healthy home hazards work. And we also want to do 325 units towards lead inspection and risk assessment. Of course, these are goals, so we can always surpass them if we can. So currently our benchmarks are as follows. Again, we started in April. So our initial goal for unit production for the first 2 quarters were at 0. During those times, it's usually our startup. So we're doing recruitment, we're doing outreach, we're taking an application, we're doing testing. So as of today, we've completed up to 9 units, which is way higher than we anticipated, as I've mentioned before in our last meeting. This quarter, we have a goal of 10. So that's between October to December. And, we already have reached 9 units. So we do anticipate to have at least 16 for this quarter, which is much higher than we anticipated. We've been doing really good with our risk assessments. We've tested over 108 units so far in Baltimore City. Some of these clients are individuals that were interested in our previous grants that were not able to make it to our old grants. So we've moved them to this new grant and have retested their home. We do have a projection of, by the end of the year, to have 20 families assisted with this program, receiving both lead renovations and healthy home hazard remediations as well. Currently we do have a property in progress, and we have 3 scheduled for this month and next month, and we also have 4 scheduled for January. I think that's all my information, but I can take questions if you have any.
Sure. So Barbara Moore has a question, and then I will follow that.
Okay.
Barbara?
This is Bob Moore from Mount Washington. I was just wondering, what is the criteria for the families to qualify?
Yeah, so for a family to get assistance, there has to be, there's income qualifications. Those are listed on our website. They do change yearly most of the time. The presence of a child visiting or living in the property, or the presence of a pregnant lady in the home. This is not a strict requirement, but we do ask for that information so we can anticipate for any elevated blood levels. We do ask for the family to get tested to ensure that, you know, we're tracking if the levels are going up or going down, and then we can kind of pinpoint that. They do have to be located in Baltimore City, and the house has to be built before 1978.
Renters and homeowner occupied, or?
Yes, we could do both rentals, owner occupied, and a vacant, as long as the owner of the vacant agrees to move in a family within 3 years.
Is it that they agreed to or agreed to market to families?
It's a little bit of both.
Okay. Just curious on that, because I know there's been some legal precedent that where owners make a good effort, but if they can't find that, I just wondered how you were resolving that. And it's 8 hours a month or 8 hours a week for a child to be present in the unit?
It is 6 hours a week.
6 hours a week. Okay.
60 for a year.
All righty. Thank you.
Question.
Yes.
I'm Brian. I'm a real estate agent. So you mentioned renters, but how would that work? Would the funds go to the renters, or it would go to the landlord, or?
So our funds funnel down to the contractors that we have. So we identify during a lead inspection what work needs to be done. And we actually have about 3 contractors right now that do the work. We provide them with a scope of work with how much it would cost. They give us back a bid, and we pay them that amount. What the program pays for is the work to be done. We also pay for relocation and any other costs that can incur while someone's leaving the home. For rentals, it's a lot different because we also want to have in good faith that the landlord is contributing to the work that's being done, because it is a requirement by law for them to keep the house safe. So owners and or landlords have to provide a 20% match towards the lead remediation work. We can assist owners in relocating the family to a hotel or providing a stipend, but that is kind of the caveat. That's a lot different than owner occupied, that they do have to provide a matching fund. And we collect income information on tenants and the owner.
But the contract is with the owner, is it not, or is it?
The contract is with the owner, absolutely.
Okay, that's what I
So we
thought.
cannot do anything with just a tenant. The owner has to be in agreement.
I think that was, Brian, that may have been what he was kind of getting to.
Yes, exactly. So who would initiate, the tenant or the landlord, or either or could?
It could be either or. If a tenant contacts us, we would ask for the owner's information and we'll contact the owner, or an owner can contact us. And most of the time, if the owner is contacting us, the tenants most likely already know, but we talk to both.
Great.
Okay.
Barbara?
Thank you.
Thank you, Mr. Barbara?
Thank you. Just some clarification. So it's my understanding for this, then the home would have already had to be inspected, already identified that there is lead in the home. Child has an elevated lead level. This could either be the primary or the secondary for the family, right? Since it's only 6 hours. in the past, the health department typically has only gone out to inspect the home when the child's been in the home more like 10 hours, minimum 10 hours per week.
Mhm.
So what's the recommendation for getting the inspection done? Well, two things. Inspections done where the lead level lab result, that address that's on there. And if it is less than 10 hours, the best way to get an inspection done for this home. And I don't know if there's anybody else on here for Baltimore City Health Department that could maybe address that as well.
Okay.
Well, our program, we do work with the health department. When it comes to testing on EBL situations, I can't really speak on their process. But if a child is referred to our program that has the EBL from the health department, we do have an expedited process to get that house tested within 48 hours. And we will reach out to we work with ARC Environmental currently to get that tested, and they're pretty good at getting that testing done for us kind of quickly.
Okay. And Catherine, being from Mount Washington, we can make the referral directly to you, or do we have to go through the health department?
Yes. I'll put
Directly.
my number and our email in the chat.
Great. Thank you very much.
Thank you, Kat. Brianna Adams from the Baltimore City Health Department. Yes, ma'am. How are you?
Good morning. Good morning, everyone. I just wanted to address Barbara's question. Since being a director, we haven't really narrowed it down to hours. I think the importance is just trying to find the source. In our referral questionnaire that we complete, we ask the family where the most time is being spent, what's the primary address and things like that. So we are typically doing the home if that's the home address, but if a family says that a child spends primarily 50% of the time with grandmom or granddad, that would be our first place to start the testing.
So just for clarity for everyone, that is the health department's process of doing lead investigations and case management with children exposed to lead, I believe, Brianna. And what Kat was talking about with regard to the amount of time a child spends in the unit is the minimum qualification to receive a grant. So, which is, I think, 6 hours a week is what she said. I think just to say there's two good things going on, right? One at the health department, one at the grant program, which sits in housing, and just to provide that clarity. And I think, Kat, I'm right about that, right?
Correct.
Okay. And Brianna, thank you very much for that. I have one question, which is, you're doing more inspections than you are doing units. What happens if you do a risk assessment and that unit doesn't get enrolled? Is there any education or anything further that happens with that unit?
Yeah, so as soon as we are contacting a client from the first conversation, that education starts, especially with us getting a risk assessment complete, not only getting that from us, but they're also getting it from our contract with ARC Environmental in their home. So the client gets a copy of that lead inspection. They're actually aware of, what areas came up positive, what came up negative, which one was the hazard, which one's not. And if they're not enrolled in the program, they still have that information. But ideally, we try to get them into the program. Even if it's not on this grant, we try to move them to another source that can get that fixed within DHED.
That leads to my next question.
Yeah.
You have a risk assessment that is done. Does the department ensure directly that both the owner of that building and the resident of the building receive a copy of the risk assessment?
So our requirement's to give it to the owner. It's not to give it to a renter. I don't see it being an issue, but I think this is just how we've always kind of done it. We give it
Yeah,
to
well, so I'm unfortunately old enough that I'll be able to cite this, but back in 1996, Baltimore City, I think it was 96, Baltimore City health department inspector was convicted of manipulating lead violation notices, et cetera, and was a property owner, and a whole bunch of things came out about, I believe it was the health department, but I don't want to, it's not a reflection of the health department. It might have been the housing department. But anyhow, Dr. Bielenson at the time implemented for the city a requirement that any inspection notice with regard to lead had to go to the residents as well as the owners. And there was just a practice of only giving it to the owners, and residents could be living in highly leaded properties and not be told by the owners. Not saying that, every owner is, good, bad, or indifferent. That's not, but I do believe that we have a moral requirement, and I believe there is a legal requirement to provide those inspection results in full to the resident of the property. I urge the city to look at this practice quickly and make any amendations to that process. I would say the same to the state. Disclosure and transparency can prevent further harm. Not criticizing any current practices, but asking that we look at that. Susan?
Thank you again, Ruth Ann. I was wondering, risk assessments being done for the program, are they following HUD Chapter 16 protocols, even if it is not an elevated blood level child? And a follow-up question is, I am all about data. That if moving forward, would it be possible to have redacted reports of those risk assessments be presented to the commission so that we can learn from them as to what the true cause or what the sources are? Thank you.
So to your last question about the risk assessments, our program is solely focused on lead-based paint hazards. We do not, and lead dust, and we do cleanup as well, but that's our main focus. We don't focus on any other potential hazards that can cause lead poisoning. We kind of leave that to the health department to determine when they do their investigations. And usually the only way that the health department would get involved in that is if there's an elevated blood level. So for our program specifically, it's just how our grant is kind of layered, is to focus on the paint. And now in regards to our risk assessments, we do follow all the HUD guidelines. It is a requirement. This grant is funded through HUD. So there are an expectation to follow all chapters in regards to the risk assessment.
Okay, we do also, thank you. And that's pretty well also outlined in the notice of funds availability and the underlying pieces of that that the city, the state, and others respond to. And Susan, that is public. I'm sure that we can share that with you and you can see it. Kevin Stanley, you're online. You posted a CFR here. And is there anything else you wanted to say on that? I guess not. But he did reference 24 CFR 35 on the evaluation and presumption of lead. I will remind everybody that under Maryland law, chipping, peeling, flaking paint is considered a lead hazard unless proven otherwise in pre-78 properties. So Susan, hang tight. I want to just ask Kevin. I asked him if he wanted to say more about his post. Kevin?
Yeah, can you hear me now?
Yep.
Sorry, I was having microphone difficulties. So I'm assuming that the program being described is ultimately a federally funded program?
Correct.
And so 24 CFR 35.125A does speak to a notice of evaluation. And then that requirement also, it requires the designated party to provide a notice to the occupants, including the owner. So I was just putting that in there for reference.
Got it. Susan, your second question? Or third,
Thank you. Just a follow-up. I mean, it's always been, presented itself as a conundrum to me because Maryland regulations, if MDE could answer, COMA regulations say that risk assessments are to be done according to Chapter 16, regardless of whether there's an EBL child. So I just wonder, is there a conflict there? I mean, especially as we continue to see the lowering of elevated blood levels as to when environmental investigations are being done, I'm of the mind that, yeah, you could have some of that elevated blood level, maybe from paint, dust from paint, but there's so many other sources. How do we know that really it's just paint if we're not looking at other sources?
Well, I do think there is an opportunity here to ensure that there is a unified approach on that. I think the opportunity to remediate the lead-based paint that comes up in the risk assessment, and the city has the opportunity to do that, should be done. Kat, I know this is more than you had probably anticipated, so I appreciate your goodwill in this. But when you get an application and you're working on it with an elevated blood lead level, does that mean that it has already been or seen by the Baltimore City Health Department case management team?
Most likely it has. In my experience so far, most of the EBLs that we've encountered has already been in process with the health department or even with MDH, to be honest. So most of the time it's notified. We do keep updates. Me and Brianna have monthly meetings, so that's a place for us to discuss how things are moving forward with any EBLs that they're kind of zeroing in on. But yes, they already are in that process.
Okay, and Brianna, did you want to comment on that before we move on?
No, we're good.
Okay, well, I know there's great work being done in both. And I think folks do know, and I mentioned at the top that this Baltimore City Health Department has recruited a wonderful human being, and oh my God, Michelle's last name is escaping me. Your new commissioner's last name, Taylor, right? Or
Yes.
yeah, from Shelby County, and we'll invite her to meet the commission. And thank you both for your good work and the questions here on that. Susan, you're on the agenda for lead-free certificates.
Sure, thank you. Let me see if I can share my screen. Can you see that? Can everybody see that?
No, nothing yet.
Not yet.
Okay, yeah, I am. Let me just look here. I am obviously tech not savvy enough.
Do you want me to pull it up for you,
I
Susan?
do, yeah, I emailed it to you. Thank you so much.
Yeah. All right, let me share.
Thank you. Okay. So this is kind of a continuation of the discussion that we started a couple of months ago. And I kind of wanted to bring it back to people's attention, given what's kind of transpired over about, I'd say, the last year or so, especially with lead-free inspections and talking about the problems and the solutions that I see as possible solutions. Next slide. So one of the things that I've really honed in on is that it would really be appreciated if the Maryland Department of the Environment could do more data sharing with the commission. I mean, we've had two major cases over the course of last several years, American Homeowner Services and Green Environmental, where there were approximately 10,000 invalidated certificates. And I think that we could really learn a lot more about the situations and the results if we had that data to look at. so that we could be preventing more cases of invalidation and or lead poisoning of children rather than reacting to them. I kind of look at this like a risk assessor, assessing the risk when we invalidate these certificates, and then possibly a solution is, you know, maybe it's not all or nothing, but kind of having a decision tree to have a more positive effect on the totality of this industry. Next slide. So, having been a lead inspector for over 30 years, there's challenges that are now presenting themselves even more so, especially as listed here, the protocols of how prior lead-free inspections were done versus today's knowledge, hindsight, the enforcement action and the invalidation of certificates today. Lead-free inspections started back in 1996 with the introduction of the regulations for full risk reduction. That's a long time ago. And interesting enough, the industry was so new at that time. From 1996 to 2008, there were no protocols provided by the Maryland Department of the Environment as to how those lead paint inspections resulting in lead-free certificates were to be done. In fact, those protocols were designed by the inspection company and submitted to the Maryland Department of the Environment with their accreditation, and those protocols had to be accepted by the Maryland Department of the Environment. Now, in 2008, MDE passed regulations, COMAR 26.16.05, that standardized all protocols for lead paint inspections. And at that time, the HUD guidelines were introduced. The Chapter 7 has been revised at least once, and the newest revision of Chapter 7, which talks about testing protocols for lead paint inspections, was revised in 2012. So we're talking 2012. We're talking, 13 years ago. And they're the most relevant inspections. And in those HUD guidelines, the way that lead paint inspections are done is what's called one XRF reading per testing combination. So a testing combination is made up of a room, a component, and a substrate. So I've given you an example. The room is the kitchen. The substrate is wood, is a windowsill, and the substrate is wood. And that then you would apply that reading to all other wood windowsills in the kitchen. We'll talk about that now in just a minute, but I see that as an issue that we've come to know that that's probably not enough. And the other issue is that the Maryland regulations for lead-free allows enclosure. You can cover up lead-based paint, not with paint, but with a rigid, durable material that's mechanically fastened. In fact, the regulations for abatement also actually allow vinyl wall coverings, which are not oftentimes mentioned, but certainly to me are not sufficient for classification as a lead-free. Next slide. Fast forward to today. I mean, if you think about it, 13 years or from 1996 to now, I mean, that's could be up as much as 30 years ago. We're talking a lead-free inspection was done. Everything has gotten more stringent, which has, especially with the lowering of the elevated blood lead level that triggers an environmental investigation. So in essence, we're doing more environmental investigations in single-family homes with lead-free certificates from many years ago. Today, the data and the experience shows us that the protocols from the guidelines that are referenced in the Maryland regulations, this one reading on a testing combination, may not be enough. And that these houses with these older lead-free certificates, there's a lot of variables that may affect the status of that lead-free certificate. First of all, Lead paint could have been enclosed and then issued a lead-free certificate. Those properties were remodeled. Carpeting could have been taken up. There's a lot of things that have happened in these properties that have basically could change the outcome of that lead-free certificate. Next slide. The consequences of these changes and knowledge that we now have is more and more invalidation of certificates. And I don't see that stopping. The cost of retesting properties with invalidated certificates, the letters that went out for Green Environmental said you had to do it within 30 days. A lot of those units with invalidated certificates, more than, I would say the majority of them were occupied. I mean, if you talk to property owners, trying to do something in less than 30 days in an occupied unit is just not realistic. Also, I wondered, you know, having gone back into many of these green environmental properties, they were occupied, found lead-based paint. What is, you know, what are we doing to assess the risk to those occupants having found lead? Are those property owners following the rules in order to make them lead-free while the unit is occupied? I think we're missing a chance to prevent children from becoming lead poisoned in the case of these invalidated certificates. And then a big constituent that, I mean, I'm as an inspector, and I'm sure there's other inspectors on the line that would agree, there's a lot of anger out there about these regulations, about these invalidations. Landlords telling, I mean, I've become a listening post. They're angry. They followed the regulations. They hired an accredited inspector off the MDE website. And now they're having to do an inspection that costs money. And it's in an occupied unit in a very short period of time. And I say to the commission members too, yes, our main goal is to prevent children from becoming lead poisoned or to eliminate it. But one of our other goals, all right, is to maintain low-cost affordable housing. And and the reaction of these property owners is that all of this money has to be, somebody's got to pay for it. And what they do is they just jack up the rent.
Okay, Susan, we're gonna have to bring this to a conclusion. Is this the final slide?
I think I have another one. Is there a reason? Are we running out of time?
We want to be able to have proper, we've got a lot.
No, I agree. I think there's just 2 more slides, Ruth Ann. If you don't mind, I'd like to finish.
Go ahead.
Wendy, could you go to the next slide? So, I don't like to pose problems without solutions. I think we're all wanting to be on the same page, right? To deal with the enclosure problem, it would be good if MDE would take paint chip samples to make sure that the lead that they may be detecting and invalidating a certificate is to confirm with a paint chip sample that enclosure is not a factor in that positive reading. Another possible solution I feel strongly about is that I think the MDE has to change the regulation protocols for lead-free. I think, Fred, you mentioned, whoever wanted the words lead-free. I mean, they're haunting us. I also would recommend to MDE that before going out to perform a lead paint inspection, maybe not with an elevated blood lead level child, but with just looking and oversight, that they consult with the inspection company that issued the lead-free certificate to see if their paperwork cannot assist in determining the accuracy of that inspection. And then last but not least, I mean, sometimes I think it shouldn't be an all or nothing approach. Perhaps there could be a triage where we assess the risk of a certificate that may have been inadvertently issued, or a certificate that actually followed the protocols, but there's still lead present. Those protocols still allow for the presence of lead-based paint. Last slide, I think, Wendy. So the other part of this really communication of data and knowledge, is that we're all on the same team. I think we need to revise and strengthen the education and accreditation requirements of all lead paint inspectors. I don't think everybody who takes a class should be an inspector. I think that I had mentioned this earlier, interpretations change with the MDE personnel. There has been a wide change in the interpretations of a visual review that has now taken place currently, which is fine, but it needs to be communicated to all inspectors in a way that we can comply. I do think too that we need to maintain a healthy relationship with our lead paint inspection companies. They are the private sector. They are the arm of MDE doing the work. So yes, they have to do a good work, but they are part of the solution. And I think we need to bring them in more into the discussion. And lastly, I am of the mind, I would like to make a motion to establish a housing subcommittee to deal with these issues. It's not just an MDE issue. It's not just a rental property owner issue. It is an issue for all. And that's kind of like what we as a committee for lead poisoning prevention are. We are bringing everybody together. And I think that we need a housing subcommittee. And I'd like to make this motion to bring together the integral parts to move forward to keep Maryland as a leader in lead poisoning prevention. And
Okay.
I would like a second on that housing committee.
Well, that's not how it quite works yet. Hang
Okay.
tight to your motion.
Certainly, that you tell me how it works, Ruth Ann.
Okay, well, we're going to try to digest a bunch of this, right? So first of all, I'd like to entertain any comments or questions. I'd love to hear from all parties on this, on Commissioner Kleinheimer's presentation. Are there any comments or questions from the field here? Thank you, Commissioner. And I'm also going to ask that if there are inspection or other inspectors on the line or risk assessors on the line, love to hear from you. Nadia?
Yeah, I have, thank you so much for this presentation. I have like maybe two questions. One of them is there a way that we could have any type of legislation to make it so that these homes that were on the lead inspection list that needed reinspection don't have significant increases in rent? Because I do think that that's a good point, that if the landlords are feeling like, well, I had to spend all of this money / new money for reinspection, I need to now increase the rent, and we're in a housing crisis in terms of rental costs. I definitely see that being an issue. And then I think my other piece is that I think that 30 days, like the idea to lengthen the reinspection to more than 30 days does not work in the advantage of renters themselves who might be in harm's way. And so a lot of the hesitancy around any lengthening of time there.
So I just want to reiterate that, Commissioner Hutchinson, I was going to raise the same point. Once we know we have an invalidated certificate in a potentially hazardous home, it should be less time, not more. And maybe you get to that by the suggestion to triage the approach, but I don't. I think it is extraordinarily risky. We can come back on the issue, but I don't think it's legislation that is needed there, but mutual service agreements or other. It's about $1,000 cost for the highest liability for the owner. But let's come back on how do we not have that passed on to tenants in just a second. Dr. Ichanowski, please.
Yeah, thanks. I've got a question. If a previously inspected house that's been passed as lead-free, if a new family moves into that house, does it get re-inspected before that family moves in?
Yes. Occupancy inspection. So it's not sitting saying that inspection, if it's a rental property, they have to do it at each and every turnover. Okay.
Okay, thanks.
Yep. Other comments or questions?
Oh, I'm sorry. I accidentally hit the button.
Oh, sorry.
Yeah, I mean, there's a couple of things. This is Brian again, a leasing agent. One of the things that or one of the reasons I should say why the cost gets passed on to tenants. Let's take something simple like a lead-free inspection. I think the price is twice the amount as a regular inspection. So for a new landlord not knowing, what this is all about, he's presented with two numbers. As a business owner, he's going to go with the first number, not looking long-term down the road that, hey, even if I can't do the lead remediation to make it lead-free, let me at least get the information of where it is located so I could, plan for that. So maybe figuring out a way to either subsidize that cost for inspectors. Not sure if this lead-free gun costs that much, why it has to be so much more. Just a thought.
Yeah, I think this one is good to be thought and recommendations to come out, but there is a cost of doing business that is part of putting the product of rental properties on the market, and the sort of better way of, if possible, for property owners to get there is to make the properties lead free or reach a high lead safe standard so that they have an opportunity to move past some of these issues. I think there's arguments on both sides that we should have a real discussion on in some of the federal grants and programs that do subsidize the risk assessments. Owners are getting benefits that they can't take a more gentrified property and be increasing rates when they've gotten that money and grant for free. This is a different situation here on the cost of doing business. But I will say, I do want to reiterate the issue of time frame and urgency. Dr. Banks, I'm sorry, right in front of me, a snake would have bit me.
That's all right. You're focused. So I got three comments regarding data sharing and the invalid certificates. So the 1,400 certificates that were invalidated were posted on the website, still posted on the website. And the public can go on and go to our database and look up the status of those certificates, where the addresses were and things like that. So we do try to provide that information.
Transparency.
Try to be as transparent as possible. The issue with the list regarding the inspectors on the accreditation list, my instincts are to take it down, but the people that I work with inform me, the people that have been here for a while inform me that without that list, people will kind of be out in the wilderness trying to find inspectors. The issue is that there's a process that goes into taking a person off that list, and we try not to be hasty. So essentially, inspector has to be have their accreditation suspended or non-accredited before we remove them off that list, or they can request to be taken off that list. So there's generally a lag time between the time we identify a person that's under investigation through the time they're actually taken off the list. So sometimes it's a little frustrating when people say, hey, we got the list from MDE. My initial reaction is to take it down, but I understand what the frustration is. But at the end of the day, we're not the ones doing these bad inspections. We're the ones trying to keep people safe. So we try as much as we can to provide information while also protecting the public.
Can I pause there, Fred, one thing? I'm going to suggest that the department consider this. If there is a valid complaint against an inspector, I think they should be taken down on a temporary basis during that investigation, and they can be put back up if they clear the investigation. But it lowers the public's liability and MDE's liability that if Barclay has these complaints out there, that we don't wait for a long process while he still continues to jack money out of people for false certificates.
Right.
And that if there is a valid investigation, and this is the way it is in most businesses, right? If there's a valid investigation on something, there's a period of time that you suspend those credentials being publicly posted. I think that's in the best interest of the state. I think it's the best interest of people, something to consider, but please finish.
All right, the last point I had was regarding requirement for lead freeze and a change in tenancy or occupancy. There is no requirement for a lead free to be re-inspected at change in occupancy. So that's just one correction I wanted to make on that. So if a person has a lead free and the current tenant moves out, that property owner is not required to get.
Well, that's only if it's a lead-free.
Only if it's lead free, yeah.
Only if it's lead-free. Gonna go to the commissioner first, Adam Skolnick.
Sorry, well, Fred just beat me to the punch. That was the first thing I wanted to say about the lead free. I think the second piece, and Fred and Paulo giggle when I say this because I'm usually the one throwing bombs at them. The system worked. I mean, I think what we've really got to remember is that they caught the scofflaws. Yes, they invalidated the certificates because some kids were, had EBLs, which is a horrible thing, but the system actually worked. We caught them. And, and potentially people are going to jail over this, which is inherently positive as well as hopefully a deterrent to bad actors. Similarly, because what I get nervous about is massively changing an entire system that's actually working. I mean, if we change the names who cares? But if we're changing the system that's working, that doesn't seem like the right solution. And similarly, and again, remember everybody, I represent in quotes the property owner / landlord community. If you hire a bad mechanic to fix your car and then you have to take it to somebody else to fix your car, that's the cost of doing business. So it's the same situation in this. If you were dumb enough to hire Green Environmental and not hire somebody who is a really good actor, and you have to get re-inspected or have to do abatement work, that's the cost of doing business. And that just is what it is. So, I want to make sure that we all understand that things worked in this situation.
Thank you for your comments. I think we're going to look at this at a subcommittee level, and your comments will be noted there as well. Susan, one question, and then we do have to move on.
Sure. Thanks again. And I think that Adam is correct. I just realized that, I don't even know how many accredited inspectors we have, but I'm actually looking out for the good guys. If we have one or two bad inspectors, how about, the protection of all the other good inspectors? That's what that's my concern.
Understood, but we are here as a commission to look after the interest of protecting children and adults and others. Right. So we have to make sure that any suggestions are not placing people in further or extended harm.
No, I'm not disagreeing with that at all, Ruth.
Commissioner Hutchinson? She wrote something in the chat. What did you write in the chat?
Yeah, in the chat, I kind of disagree a little bit with Adam here in that I feel like things didn't work that effectively if hundreds of homes were impacted before the fraud was caught. Like, I think that there is a breach in trust now between community members and MDE because it took so long and so many homes had bad inspections before it was caught. And then also that there was such a delay before notification of people.
Understand and agree. And what I will challenge us is as we move this to a subcommittee review to come back with any comments or recommendations, is I think we have to think very hard that the department and everyone involved is is there something that could have happened earlier? Is there a way to be more proactive in this? And obviously education, but are there mechanisms or things that we can think of that would be further upstream? Barbara Moore wrote, is there a data report with the number of lead-free certificates with year done and dust and XRF required? Fred?
Yes.
Answer is yes. You want to say more than that?
So, Barbara, this is something we look at regularly. But there's a lot of lead frees out there, tens of thousands of them. So we are looking at these certificates and the conditions of the properties daily, but, like I said, there's just a lot of them. So, but yeah, there's several reports we have in our database where we can pull out and add variables to see if there's properties we need to take a look at. We prioritize everything. And so as a part of that prioritization process, we look at, people at risk first, all the way down to properties that are not occupied or, up for rent to even owner occupied in some cases. So.
Okay. Thank you very much. Susan, thank you for taking the time. Really appreciate that and have given us a lot to look at. I'm going to encourage everybody to go. Wendy, if you'll post it again, just for ease, the committee assignments, sign-ups, we will look for where housing will lie, and that will be very clear on that. And we will now move to just hot topics, and just for a heads up for GHHI, Shadi, I'm going to look to you and others, not myself. But before I go any further, Ally, anything from a parent's standpoint or point of view here that you've heard today?
Yeah, it's been
Not to
interesting.
put you on the spot. You're sitting next to me, so.
Yeah, that's true. No, it's been really interesting to listen because we were in an owner occupied home, and had no idea. And it was previously a rental. And so it was inspected the year before we moved in, and still my son's levels were astronomical.
Great.
So
we should look up who did the inspection and
Yes.
on that.
Yes,
That's something to, look at.
yeah, and we did end up having Susan come out after the health department, and she actually found things that the health department didn't find. So that is something that's really interesting to me to see, like, what was the difference between what Susan was testing and what the health department was testing. And I know that she was
Yeah.
the woman that came was under a lot of stress because there was a lot of houses that she had to do, but
Yeah,
still.
so that's an interesting, Brianna, I don't know if you heard that. Are you still on the line here?
Yes.
Brianna? So what Ally is saying is that it's the inspection after her child was with the elevated blood level, that the inspection that health department did not pick up things that were picked up in a private inspection. And I know this was a number of years ago now, a couple of years back at least, but I do think this may be worth the health department to look at and kind of figure out why that would be, and what the health department is doing in its inspection, and why a private inspection would pick up more things. Not even a judgment of right, wrong, or indifferent, but certainly to understand where we could move those inspections much more proactively, much quicker. But I think there ought to be clear standards here that regardless of who's conducting the inspection should be standardized there. So I don't know more about the private inspection, whether they just did extra things, but obviously we want to find all hazards. So I would encourage that the health department maybe lead that look or discussion or convening. I'm happy to help support that, but I think that's an important point. So let's get to here, MDE, Fred has your name here, so.
All right. So we are in renewal season, and so we're hustling to notify as many people as possible to remind property owners to renew their properties. Just as a reminder, the fees increase January 1 for renewals and new registrations. And as of December 31st, you will be late if you haven't renewed your property. So if you know people that are property owners, remind them to get their renewals and their registrations in.
So they can do that by December 31 and save money.
That's right.
Okay. Can I ask, is MDE doing a social media campaign that can be
Yeah.
shared?
So it should, one should have already gone out August on department social media.
Okay.
But we'll probably get that out again before Thanksgiving.
Dottie and Riley, can we make sure that we have it and we're amplifying it and make sure through the social media and encourage others to do that? Thank you, Shadia, for the thumbs.
Fred, I can look into that. You want me to look?
Okay, any other fun and exciting things out of MDE?
Who is that?
Can I ask a question?
Yes.
So I want to make sure we're talking about the same thing. So in the budget bill from this last year, my understanding is that changed to, for renewing registration for flood affected homes is swapped to every 2 years.
Correct.
As opposed to every 1 year.
Yeah.
So when is that going to be going into effect for homeowners?
January 1st,
January 1st? Okay.
2026.
So everybody has to renew this year by
Yes.
December 31,
Yeah.
and then it'll be 2 years.
Yeah.
Okay, unless you're a brand new okay. That answer your question?
Yes. thank you.
Okay, great. All right, MDH.
Good morning, everybody.
Oh, there he
Can you guys
is.
hear me?
Yes.
Okay. Well, the first thing to say is to acknowledge all the fine work done by our staff here at the department, the local health department staff, and staff at GHHI for Lead Poisoning Prevention Week, which did, I think, a really nice job of pointing out attention to the persistent problem of lead poisoning prevention. And I particularly want to acknowledge the Dorchester County Health Department and the work that they did to focus some attention on the problem and challenge of lead poisoning prevention on the shore, on the eastern shore, because this is a problem that exists not just in central Maryland, but also western Maryland and the eastern shore. And one of the things that I think we're going to be discussing is how we can continue that by potentially having a future event in either Allegheny, Washington, or Garrett County to talk about the challenge in western Maryland. The other thing to say is we've been working very hard, apropos of the earlier discussion about housing. We've been working very hard with Baltimore City Health Department, Baltimore Department of Housing and Community Development, the Maryland Department of Housing and Community Development. And I think one of the things that we have experienced is we still have opportunities to improve our communications in and amongst all of those agencies. I think that is also true probably for Baltimore County Health Department and the Baltimore County Department of Housing and Community Development, where because we have these multiple grants and funding lines, we really do want to try to be as efficient as possible in terms of providing relief to both homeowners and renters. I'm very interested. I think we, working with Medicaid, have been talking about how we can efficiently keep Baltimore City, Baltimore County, and the health departments and us all on the same page with respect to providing services to families in the most efficient way possible. So I think that those are some ongoing challenges that and opportunities that we are looking at. The final thing I would say is that, not a surprise to anybody, we are watching what's happening in Washington and with the federal budget and continuing to do that very closely. And with respect to both the shutdown and then whatever happens after Congress returns, in terms of particularly impacts on Medicaid, we are going to have to be able to respond very quickly and nimbly when and if there finally is clarity on whatever happens with both CHIP and Medicaid and the state budget. So it's going to be, I think, we're all going to be looking at this very closely.
Yep. And not a political comment, but when Congress opens back up, there is still one unsworn elected representative, I believe, from Arizona. Now there will be two more from Virginia and New Jersey as those two of those seats elevated to the governorship of those two states. And there is concern that some not great stuff could fly through the House in that window. So we're going to have to keep really good diligence there on what happens there. But for those of us in Baltimore, Nancy Pelosi has retired and will not run for re-election. I don't know if people have seen that, but since she's from Baltimore, I will just let people know that. But thank you, Cliff, on that. Dr. Ichanowski.
I'm not allowed to be.
I'm sorry.
Hi, everybody. Yeah, the AAP chapter did post a video on social media for Lead Poisoning Prevention Week. I talked about the importance of getting children screened and also show parents where to find the QR codes on baby food packaging and how to go about finding the results of the heavy metal testing that was done on those foods. I scanned one grocery store shelves and it seemed like the manufacturers were in compliance with that. The video, if anybody's interested, should be on our social media under Maryland Chapter, American Academy of Pediatrics on Facebook, LinkedIn, Instagram, and maybe one other social media account. I could also forward a copy of the video to Wendy and have her share it with the commission if everybody would like to see that. The video hasn't gone viral to my knowledge at this point, but if anybody wants to help to amplify the message, the information would be greatly appreciated if it's shared as widely as possible.
If you will share that link with me or with the commission, I will ensure that GHHI will amplify that for sure and share it with others.
Okay, thank you.
All right, and thank you for that the education and outreach, MSDE, OCC, Angela.
Yes, ma'am. The Office of Child Care sent out information to the parents and also to the child care community in reference to the lead poisoning and importance of testing the children and providing lead-safe child care environment, including the toys and other equipments that are used. That was well received, and also we had questions from the licensing office, follow-up questions about like additional information that I was able to provide. So I thought we did good with the promoting the lead information during the campaign time. And in addition, I also met with the MDH and the MDE of water testing in the childcare community, childcare centers with the WSSC water representative. With the upcoming final rule with the 2027, the lead copper rule for testing the water outlets in childcare programs. They are planning for 20% volunteer testing in the programs and developing the information so that the Office of Child Care could review it and approve it for this project implementation. So this is work in progress.
Wow, really great stuff there. And from your outreach and education, if there was any, if you have needs for any training, education, or support in getting back for any groups or people within that for which you want public education around anything on lead, please let us know. And between the groups that are here and others will support that. And thank you for that good work. And the lead and copper call out, I think, especially very important right now. MIA, Benita?
No, we have nothing.
Thank you. Nicola from the state, DHCD.
Hi, everybody. And currently, we are still working on getting our 2 new HUD programs off the ground. Unfortunately, we had some positions we need for those programs tied up in the hiring freeze, but it looks like we'll be getting somewhere to get the reinforcements. We'll need to get those off the ground. In the meantime, our existing programs have been handling, all the incoming lead cases and other rehabilitation cases. We already have 2 funding sources that address lead. We have recently seen over the summer months an uptick in applications for our rehab programs, which we attribute to including the rehab programs in our energy program application. So that has made the rehab programs more front and center to a lot of customers that are coming to us for energy programs, where we're also doing a lot of outreach. All the outreach on the energy program side is therefore benefiting the rehab programs, and we're continuing to do that as we're growing the energy programs. And then one of the main things on top of our minds right now is the heating season, and obviously we're all a bit concerned about LIHEAP funding coming to the state hopefully pretty soon.
Yeah, we don't want the state to have to be in a position of that they have put in for SNAP now to have to do the LIHEAP. This is an issue that I think affects both rural and urban communities. It affects communities, and regardless of the politics of the states across the country. So please keep us up to speed on that. But it also goes to the real need to take the advantage for groups that you're working with, take advantage of the energy programs that DHCD is offering to get to the root causes of high energy consumption and bills, to lower that and have less need to rely on LIHEAP. I think DHC is doing such a great job. Nicole Hart or Kat, are you representing Nicole for any other updates from HCD? You gave such a great update.
Kat left the meeting about 15 minutes ago.
Huh?
She left the meeting about 15
Left the
minutes ago.
meeting.
She wrote a note.
Okay. There are big changes happening at the department. We'll hear from them next time. Baltimore City Health Department, any further changes or updates?
We are still looking for our sanitarian supervisor. We're working very immensely closely with DHR to find a supervisor for our sanitarian positions. I just wanted to thank everyone that helped the Baltimore City Health Department during Lead Week and our initiatives and outreach. Outside of Lead Week itself, Baltimore City was present at 9 outreach events for the month of October. On Friday and Saturday, we were able to test 24 children, and we seen about 62 individuals on that Saturday, and was able to provide outreach and information from not only Baltimore City, but other partners that were present.
Fantastic and great job on that. Thank you so much. Baltimore Renters United.
Yeah, I guess only small update here is that, as already mentioned, we're in the federal government shutdown. We have been just uplifting for Baltimore City residents the different various programs that the Baltimore City government has been offering. That's rental assistance for furloughed workers, as well as a plethora of food banks that have been activating to meet the need in this moment. And just reminding people of all the amazing resources here. Thank you.
Thank you. Shadia or Riley, anything for updating?
Hi all, thank you, Ruth-Ann. I just again wanted to second or third or fourth on the thanks for the support during
It's hard to play that clean up, right? Clean up better here. So.
But yeah, just want to thank everybody for all their support. And then I especially want to give a huge shout out to Dorchester County Health Department for all of their support over in Cambridge. And I also want to give a huge shout out to MDE. We had phenomenal turnout from MDE staff at all of our events. So incredibly grateful for your partnership in this work. Just because Lead Week is over does not mean the lead work does not continue. So we are still rolling with tenant-based lead education, property owner trainings, etc. We're very happy to have Riley on board. So thank you guys very much.
amazing and great. And we are super pleased to have Riley on board. Thank you. And brings amazing skills to the table. I saw there is some, Wendy, you had noted that former Commissioner Connor had sent some questions over. I think we are directing those to the department to ask for answers and then to hopefully present. And by the way, in January, we apparently don't meet in December, but if I'll be sitting here in December, probably by myself, showing up anyhow. But Patrick, you're on the line. You have some good comments here. Would you like to come online and say anything more? And appreciate the reemergence of Lena and very valuable.
Thank you, Ruth Ann. My only comment, and it's been echoed at least 3 times, I would be very curious in the future to know how the department is leveraging the database that inspectors and risk assessors provide data to them. I was very curious last night after seeing the recent list, and I know it's history, about green environmental, but 3 of the things that I posted, I just find worthy of understanding. That green environmental in 2022 posted to the database 4 unique MDE 330 forms for the same affected property, just hours apart. Logically, that doesn't seem to happen, yet it occurred and it was in the database. Following that activity in 2022, Green Environmental was able to post 2 unique MDE 330 certificate numbers for lead-free on the same property on the same day at the same time. Not hours apart, not minutes apart, actually in the same hour and minute. And lastly, in 2023, Green Environmental was able to publish 2 unique certificate numbers, one for limited lead-free, and then immediately following, same day, one for lead-free. And I'm just curious as to how we can better mine the data to detect inspectors that may, as Commissioner Kleinhammer indicated, that may require compliance assistance from the department, because clearly something's happening known to the database, maybe not known to a human, but there's clearly activity that appears fraudulent, and maybe the inspector requires contact from the department to assist them with getting back on board. And lastly, and I thank you for the public time, is I would encourage, as Commissioner Kleinhammer mentioned, some level of monthly reporting related to cleaning up these 1,400 certificates. Yes, many of them are one-to-one relationships, a potential invalidated risk reduction, definitely. But when you look at the inspection type of lead-free and lead-free limited, those are impacting individually hundreds of units, and in totality, thousands of units that we should really understand what the status is. And that's it, Ruth Ann, and thank you again for time.
Sorry about that. I was looking for the unmute button. Fred, do you have anything you want to say in response, please?
Yeah, so
And then, and Chris, we're coming to you as well.
So, Mr. Connor, we're totally on the same page. I can tell you that the earlier ones in 2022 were what we call legacy certificates that were not processed in LRCA, but were migrated over. For the later ones, we have what we like to call tickets into, so for you guys that are unaware, the database, the LRCA database that Mr. Connor is referring to is essentially in version 1. So we're working with our IT department to go through upgrades, improvements, identify issues that the public kind of lets us know that things we need to work on. So we're constantly trying to make improvements to the database so we can identify right now that the anomalies that Mr. Connor was just talking about, people have to identify those. But what we're trying to put in place is automatic notifications for the system to say, hey, you can't do that. We're sort of hesitant on some of those because there are situations where, and I have to look at the properties that you're specifically talking about, but if an inspector does 3 inspections in one day but doesn't upload the information until he gets back to he or she gets back to their computer, the way they put that information in, this may be just the way they're putting it in. It may not be how those inspections actually occurred. So sometimes we do reach out to inspectors, say, hey, you put in that you did 3 inspections within 10 minutes of each other. Is that what you meant to say, or is that, how did that really occur? So there's variables that we need to link together to make sure that we're not preventing people from doing their jobs, but also maintaining open communication with the inspector population so they understand, what happens when they put those inspection certificates on our database. But then before we put in any stopgaps to prevent people from doing any falsification of information, that we make sure we walk through that process, or how, as Kleinheimer kind of mentioned, that we triage sort of the administrative burdens that it may cause to the public in their efforts to try to do the job. So we're on it. We're aware of, what that looked like, but
yeah. And Commissioner Banks, I really appreciate the explanation. And I do catch on that I think that's really applicable with items like risk reductions that are done several times a day. But what has caught my eye last night reviewing the new information is how many limited and one-time lead frees that Green Environmental was able to process. And now that we understand at some periods of time, Green Environmental didn't even have an X-ray fluorescent analyzer to take readings, yet they made up reports. Somewhat disturbing.
Yeah. Yes. Yep.
Okay. Further comments or questions, Chris?
Yes, hi, how you doing? I had a couple comments and some questions. So,
Chris, can you say who you're with, please?
yes, I'm sorry. I'm here on behalf of Reliable Property Management Company. We manage and own about 2,500 properties throughout Baltimore City. And some of these cases that popped up are on some of our properties that we've recently taken over. In the past year, we bought out a company called CR Maryland, and a lot of these units were occupied. Some of the questions I was having was basically, like I said, we've had multiple cases with children tested for high lead. But one of my questions is, it's often unclear when exposure occurred, whether it's from a previous residence, daycare, with relatives' home. And I noticed there's limited forensic tracing to confirm that the property is a true source. And what I'm urging is that we consider to do more comprehensive investigations before assigning liability to the landlords.
Anyone have a thought or response to that?
Ruth Ann, if I may, it's Patrick Connor from Finback
Sure.
670. Chris, I would again follow up with Commissioner Kleinhammer's comment. That's why you should be expecting and receiving an investigation in accordance with HUD Chapter 16 as the documented methodology. That should, actually by design, provide you a very solid pathway as to sources of exposure.
Mhm.
Most of the time, those HUD Chapter 16s, which are inspection, risk assessments, and other non-paint related investigations, do show that it's multi-source, multimedia. And that's what I think you should be looking for.
Right.
And as others mentioned on this call, it's not the difference between a government inspector and a private inspector. We all have to follow the same documented methodologies and the rules. So we should all be reaching the same conclusions for the public.
Thank you.
All righty, and we appreciate the public's interest here. Wendy, do we have other hands up or other comments?
No hands up, and we're all good with the comments. So Patrick, I added your comments to a separate document with a running list of all your comments so that we can try to get them addressed. And I'll share them with Fred so that we can take care of that.
And
Thank you. And
Thank
Wendy,
you.
as many people say this, I truly appreciate what you do, because without you, something would not get done.
I appreciate that. Thank you. I
All
try.
There
No,
you
it's
go.
all of us working together as a team. You know,
Unsung Hero Award right there. All right, appreciate everyone. I want to reiterate our thanks to MDH, MDE, and so many others during Lead Week and every day to all of you for spending the time. We've got some pretty actionable items out of here. Please, please, please sign up for a committee, or otherwise Wendy and I are going to assign you. We appreciate,
Ruthann,
yes.
is this going, I'm going to send the link out to only the commissioners or all the guests and commissioners?
First, we're going to get all the commissioners assigned, and then we will open it up to subject matter experts. The committees will reach out to subject matter experts and participation. All righty. We appreciate you. We are formally closed, and thank you.
Yes. As a reminder, though, no
January
meeting in December. We'll reconvene in January 8th. Everybody have a safe, happy holiday.
You're welcome. You're welcome to come to the GHHI Christmas party on holiday party, on December 4th. In lieu of that, we'll treat you well. All right. Thank you all.